The standard of care for never-event medical errors. A 77-year-old patient was admitted to the hospital for malnutrition. He fell the following day, fractured his hip. He was operated but never recovered, and he died as a result. The attending physician's decision-making and pre-fall documentation were excellent. Yet, at a subsequent date, a process server entered the physician's office and handed a medical malpractice wrongful death lawsuit. At deposition, the defendant physician answered yes to all the following questions except the last question. And here are the questions. Doctor, is it true that Mr. J.B. was 77 years old and a long-time patient of yours until he died? Was he self-sufficient and mentally competent before he was hospitalized? On January 22, 2011, did you admit Mr. J.B. to the hospital for nutritional management because he was malnourished? Did you state in your admission note that he was a little shaky on his feet? Did you order that he was to be up only with assistance, and you explained this to the patient, and did he express his understanding and agreement? Now, doctor, on the day following his admission to the hospital, Mr. J.B. needed to use the bathroom, and he got up on his own, fell, and broke his hip. Is that correct? And did Mr. J.B. have surgery for a total hip replacement 2 days after he fell? But he never fully recovered from his fall and hip surgery, and he died on February 19, 2011. Is that correct? Doctor, are you familiar with the term never event? Are you aware that the federal government has a list of injuries a patient should never suffer in a hospital? Doctor, are you aware that the Center for Medicare and Medicaid Services has identified several never events, including, among others, operating on the wrong body part or wrong patient, giving wrong blood to the patient, leaving a foreign object in a patient after surgery, bed sores, catheter infections, lung clots, burns, and electric shock? Is that correct? And an inpatient fall is specifically mentioned on the never event list, isn't it? Doctor, is it not true that the inpatient fall is an event the federal government considers a serious, preventable medical error that should never happen? Now, doctor, our government considers these never events to be such serious errors in medical care and so easily prevented that Medicare won't even pay the hospital for treatment needed when these never events occur. Is that true? And now the doctor answered, I am familiar with the cost reduction policy established by the Center for Medicare and Medicaid Services as part of the Deficit Reduction Act. I believe this is a reimbursement mechanism, not a statement of the standards for quality of care. It is my understanding the standard of care in my case is set by state law, not by CMS policy. Despite the statements by the CMS, many of the so-called never events cannot be prevented even with totally reasonable care that meets and even exceeds the standard of care. The only way to totally prevent patient falls would be to disable all hospital patients with leather restraints or medications, and I'm not sure anybody would want that. Since 2008, hospital falls have been placed on the never events list of non-covered hospital-acquired conditions compiled by the Centers for Medicare and Medicaid Services, CMS. CMS adopted the list from the one created by the National Quality Forum in an effort to encourage a safer health system and to reduce payments to providers pursuant to the Deficit Reduction Act of 2005. In January 2009, the CMS specifically referred to never events as serious preventable errors in medical care. Litigation involving never event medical errors is novel, and not many cases have yet hinged on that term, which has a foreboding and ominous ring to it. Juries can understand it, and plaintiffs' lawyers would love to use it at deposition and in court. Physicians who are sued on a claim arising out of a never event should discuss the issue with their defense counsel and obtain specific advice on how to handle questions by plaintiff attorney. Some state law may allow the defense attorney to move the court for an order precluding references to the phrase never event at trial. States generally have standard jury instructions or case law precedent establishing the applicable definition of the standard of care. Typically, the physician is required to act as would a reasonable and prudent member of his or her specialty when faced with the same or similar circumstances. The physician is not required to guarantee patient safety and is not legally liable for every injury or adverse outcome. Most states hold that hospital policies, Joint Commission standards, and the like are not evidence of the standard of care that applies in a medical malpractice case, and the CMS reimbursement policies should probably fall into the same category. The rules of evidence generally prohibit evidence where the probative value is outweighed by prejudicial effect. The CMS policy and the phrase never event have no direct relationship to the applicable standard of care in a malpractice case. Thus, evidence of the CMS never events has no probative value because it would not help the jury to decide a contested case. Simply permitting the words never event to be uttered before the jury would be highly prejudicial. The court may agree that questions involving never events, which may be asked on deposition, would not be repeated at trial, and the physician's actions will be judged in accordance with the state law standard of care. In the above inpatient fall and wrongful death case, the defense counsel should emphasize the fact that the defendant physician properly assessed the patient's physical and mental condition, including his mobility and his ability to comprehend and follow instructions, and the patient gave every indication of understanding and agreeing with the physician's instruction that he signal for a nurse if he needed to get up from the bed. In doing so, the physician met the standard of care. Thank you.